Welcome to Adaptive NCLEX, and thank you for joining this channel. This is a quick review, nutritional for the NCLEX subscriber request. Sometimes these questions pop up all the time in terms of therapeutic nutrition, macromolecule, micromolecule. So just want to give you some facts so that you can use it for your test. So there's a daily requirement of certain macromolecule. For protein, which is a big macromolecule, you need to have 10 to 35%. Fats should constitute about 20 to 25%. And carbohydrate, which is one of the big macromolecule and one of our staple foods, consists about 40 and 65% of it. Sometimes they also ask you how much fiber requirement is, and if everybody needs a day, you need 25 grams per day for women, and 30 to 35 grams a day for men. Remember, these values changes if you're pregnant, you need more. If you're a child, you need more. If you're lactating, you need more. If you're a teenager, because of growth, you need more. Okay. There's also how much calories you get from fat, protein, and carbohydrate. So 1 gram of protein will give you about the 4 calories. Okay. And then the same thing, 1 gram of carbohydrate. We do the same thing. We give you 4 calories. However, 1 gram of fat is one of the high source of energy. Will give you 9 calories. We need to give you a question: how much calories will you get from 20 grams of fat? Yeah, you multiply that by 9 and you'll get it. So these are very, very important numbers that you need to know just like that. Okay. What is the requirement for an older patient? What are the things they need? Where they need about 8 glasses of water a day. They need to also increase their fiber, at least if it's a male, 30 grams of fiber. They need calcium for your bone. They need vitamin D, and they need B12, vitamin B12 for their functioning, and then low salt diet. These are something that you have to know right away. Okay. So quick facts, like I said, straightforward information that you're supposed to know for your NCLEX. For the macromolecule that we talk about, you have carbohydrate, okay, you have a protein and fat. These are big macromolecules that you need. There's also vitamins that you will need, which are the micro, basically the micro molecule, and then there's nutrients. For the vitamins, the best way to distinguish between them is to have like fat soluble vitamins versus water soluble vitamin. Okay, so the fat soluble vitamins, the best way to remember them is ADEK. The vitamins that can dissolve in fat. These can accumulate in your body for a long time, so you can have toxicity from this. So you got to watch how much fat vitamins you're getting in your system, because of toxicity. You can get it from it, so you got to be careful from it. The water soluble one, not that. Your body can get rid of it easily without any problem. So we're going to take each of them and see what deficiency you get from it. So, we have vitamin A. Vitamin A, where do you get it from? You get it from liver. So you got to know where it's. You can get it from liver, egg yolk, um, whole milk, and some green, yellow vegetables. That's the best source of vitamin A. Okay, so if you have deficiency of this problem, what do you get? You have night blindness. Very, very important. Your skin will not look normal. You can get multiple skin infection. And then we have something we call zero thalamus. So that is like something that usually pop up all the time. So leukemia and then a corneal ulceration. So mostly eye problems with vitamin A. Okay. Like I said, this fat soluble vitamin. So you got to watch how much you take in. The D, which you already know, vitamin D basically is used for calcification of bone, and then it helps with absorption of calcium. That is its main function. Uh, where do you get um, these vitamins from? You get it usually green leafy vegetables, and you can get it from fat, oil, fish oil, especially margarine, and even sunlight. Okay, um, even sunlight, you can get it from there. So very, very important. It's needed for calcium absorption. Deficiency is to get a ricket. They have like a bow-legged and a poor bone growth. Very important. Um, and you see these patients all the time. The bow-legged, they have deficiency of a vitamin D, and it's become a problem. They have um, calcium deficiency because you can't absorb calcium without vitamin D. So that's that one. Then vitamin E is an antioxidant, very, very important. Okay, and it's used for growth. Okay, where do you get it? Also get it from green leafy vegetables is everywhere. You get a bunch of stuff from it. That's why you got to eat your vegetables. Very, very important. Um, you can also get it from fat, um, liver, and some grains. Okay. Uh, the if you have deficiency of that, it's really bad. You get breakdown of your red blood cells. You can get a hemolytic anemia because of the antioxidant effect. So hemolytic anemia is very, very important. Um, so we tell people to have vitamin E in their diet, in order to ensure prevent breakdown of the red blood cell. The vitamin K, you've seen it before, very, very important, used for clotting, so blood clotting, that's its function. And you get it from leafy green vegetables. You get it, that's where you can also get it from egg. Cheese is also having um, in the liver, okay, you can get it from liver and the egg yolk. If you have deficiency, well, you're going to have bleeding issue. And it become a problem. So patient, especially if the level is very low, yeah, you can bleed a lot. So we got to take care of that issue by giving vitamin, especially for kids like that who lack vitamin K because they don't have the bacteria, enough bacteria in their gut. Most of it is made in your gut, but you can replace it um, orally or by injection. So that's very important. These are fat-soluble vitamins, ADEK, that you need to know for your exams. Straightforward. Where you get it from, what side effects you get, and then what do you expect when you have deficiency and how to treat it. Okay. The water soluble vitamin is like there's a lot of them. And so we'll just go the main ones as much as possible, and so that you can be familiar with them. It's good to be familiar with them as much as possible. We have vitamin C, okay, and then where do you get it from? Citrus fruit, okay. It's very important. You can get like broccoli. It's also one of them. That's where you can get it, vitamin C from. Um, you can also get it in green leafy vegetables. That's where you can get it from. Um, and then cheese. Cheese also has vitamin C. What is the function? Is synthesis of collagen. Very, very important structure. If you don't have a deficiency, there's something we call scurvy. Okay, so we have scurvy, where the joints are very weak and the kid is very anemic. So you have like weak joints and they're anemic because of lack of collagens. The very important structures. Okay. The next vitamins we talk about is thiamine. Okay, this is vitamin B1. Okay, and you've seen it before in alcoholic. It's used for normal growth. Okay, normal growth, and also carbohydrate metabolism. That's why when alcoholic come in and you want to give them banana bag and you're more nourished, you try to give them better B1. Thiamine is in the banana bag before you give them glucose. Otherwise, they will get encephalopathy. Very, very important clinically. Um, where do you get this? Legumes. Legumes is the best place to get it. Legumes, enriched grains that are enriched with thiamine is very good. Okay, and of course, egg is never a bad idea. What is deficiency of that? You have something we call BeriBeri. There's wet BeriBeri and a dry BeriBeri. You don't need to know too much about it, but basically what it means is they have numbness and decreased reflexes. You have decreased reflexes and fatigue. And this happens in alcoholics, so um, very, very important. Okay, so vitamin B1 deficiency, we get BeriBeri, numbness, decreased reflex, and fatigue. Okay, then there's a vitamin B2, which we both, so it's very important. And where do you get it from? You get it from milk and liver source. Okay, what deficiency? There's no big deficiency, but it is you have tissue problem, inflammation of the tissue cannot uh, help with that, or you have what we call riboflavins deficiency, but not that important, so don't worry about it. Um, then the third one, so we have B1, then we have B3. So we have B1, B2, B3. B3 is nice, and you heard about it. Um, very important structure that we need uh, in our diet. It's called nicotinic acid. This is nicotinic acid. And it's used for normal growth. You can find this in meat, some grains, okay, some beans, peanuts, okay, and then rich grains. The best way to remember this problem, I call them the three Ds. Okay, if you have deficiency of that, you have dementia. Okay, and diarrhea. That is the easy way to remember. So when they give you a patient who has dementia, dermatitis, and diarrhea, and sometimes flushing of the skin, yeah, you know they have B3 deficiency. But the first 3D is very important. That's the way to recognize B3 deficiency, dementia, dermatitis, and then diarrhea. Some of the common symptoms for this problem that you see when you have deficiency of that. Okay, then we have, there's no B4, but then you move to B6. Okay, vitamin B6, which are water soluble, and sometimes you see they write pyridoxine. So this is what you give to a patient when you're taking isoniazid to prevent peripheral neuropathy. It's used for amino acid synthesis. You can find it in corn, okay, find it in corn, yeast, wheat, and organ meats. So deficiency, basically, patient will have peripheral neuropathy. Okay, that's the easy way to remember peripheral neuropathy and some balance problem. Okay, very common in the patient on isoniazid. Okay, then we come to B12. B12 is any portion of the colon, and it's very, very common. And it's used for nerve function and your blood cell formation. So nerve function and RBC formation. That's their function. Where did you get it? Milk, meat, and sometimes milk product. Okay, you can get it from liver to and kidney, like organ meat. Deficiency, like I said, is common. They usually have pins and needles, but it's different. Okay, it's different. They can have pernicious anemia. They can have balance problem. So balance issue. So you got to watch them for balance issue. Otherwise, they're going to fall. But they have peripheral, like it's not a true peripheral neuropathy, but mostly pernicious anemia and a balance issue, ataxia, and then balance issue. So those are water soluble vitamin. Let me add folic acid to it, since to complete the list. Folic acid, very, very important. Also involving RBC formation, red blood cell formation. You can get it from liver, okay, orange, and broccoli. Also can get it. Deficiency, you know that you get anemia due to that, and it can also cause problem in female if they don't have it, like folate, neurotube defect in children without that. So those are the vitamins you need to know. They are micro molecules. So, like I said, fat soluble. You have to know which one are fat soluble and which one are water soluble. The water soluble one, your body gets rid of it easily. Okay, so no toxicity. Okay, you can take a bunch of it, your body doesn't need it, get rid of it. But the fat one stores it, and then you can get toxicity from it. Okay. Then in order to complete it, I will call them the minerals. Okay. Maybe it's on the other slide, but I'll stay here and I'll say the minerals are just basically electrolytes. Okay, electrolytes. We nutrition, we change it. But if you want details on that, I have a electrolyte review. I'll be linked to this video and you can look at it carefully. But there will be calcium. These are calcium. The main one are calcium, sodium, okay, potassium, magnesium, phosphorus. Sometimes they had like fluoride to it and iodine. But this calcium, magnesium, phosphate, and potassium are the most important minerals you're supposed to know and their functions. So like I say, I'll link a video. You can check those and it can help with but just briefly, just a brief calcium, what calcium is for bone formation. Is vitamin D help with the absorption. But it's for bone formation and muscle contraction. That is its function. You can get it from milk product, okay? Milk product, green leafy vegetables, eggs, okay? And if you have deficiency, you can get a ricket, and then a very poor bone formation. Just a brief overview, okay? And phosphorus is also used for bone formation, and it's usually opposite to the concentration of the calcium and phosphorus. Also, you can get it from milk and eggs, and then deficiency can also cause rickets. Okay. Sodium, sodium is just for osmotic balance, and then you can get it from canned vegetables, milk, and processed food, and then it's used to maintain your hemostasis. So when we get to the end, I'll just talk to potassium diet and calcium diet and then sodium diet. But like I said, the details of this, you can be linked to the video in terms of the minerals. You already know them, electrolytes, and then you can check them out. So that's what I said previously. Therapeutic diet. What does that mean? Therapeutic diet is diet that is modified patient need. That's all. Depending on what your needs are, every diet will be changed to meet your need. So this is where you have to know the difference between the diet. So number one is clear liquid diet. Indication. Why do you need this? Okay, this is when a patient just immediate post-op, just came out from surgery, okay, or is preparing for surgery or some therapeutic procedure. Yeah, and then they cannot tolerate regular food. So that's when you give it to them. Types. What is the examples of all examples? Examples of clear liquid. It's straightforward. Me, the way I see it, any see-through liquid. That's all. If I can see through it and is soluble or liquid form in room temperature, then it's a clear liquid diet. The exception is you can have tea and coffee. which you cannot see through. But examples are what? Examples, things you can see through, like water, carbonated drinks, okay, juice, clear juice. Okay, when you put juice, it has to be clear. Okay, gelatin. Okay, and like I said, except coffee and tea, they are all clear liquid. So if you can see through, then you can classify them as clear liquid dye. If you can see through. So if you can see through, then I'll call it clear liquid dye. If I cannot see through, you cannot call it clear liquid, except when it's caffeine and tea, because you can see through. Okay. Then the next level is full liquid. Let me use another color. What is full liquid dye? A full liquid dye, usually you advance from clear to full liquid, and if you want to go, it's in between clear liquid and regular dye. Basically, that's what it is. And it's very, very good, because then you can see what the patient is doing. If they cannot, so indication is they can't tolerate regular diet, or you're giving them some time to transition to regular diet. You just want them to transition to that slowly. Yeah, you can use it. So what are the examples? Examples are anything that is clear plus milk product. That's the best way to recognize it. Every liquid has a milk product, like custard, yeah, pudding, cream, soup, ice cream, anything like that that has a milk product. Yeah, you can consider that as a full liquid. It's very, very important. Um, the nutritionally, it's not that the best, but it can provide something to the patient. You cannot take, there's no jam. Okay, jam is not allowed in this case. Fruits are not allowed. Nuts are not allowed, and solid food are not allowed. So you don't take any of them. Okay. The next one is pureed. So pureed, they call it pureed dye if you heard it before. All it means is it's the same diet. It's between full liquid and regular diet. But when we use it for patient indication of swallowing problem. They can't swallow and can't chew well, but mostly swallow. So the food example would be any food drink that is pureed to thickness. So food pureed together. The thickness may vary depending on the patient needs. Example like pureed nuts, okay, pureed vegetables and fruits. They can have some scrambled egg though, yeah. So that is very, very important. That is another form of food that you know. But like I said, know the indication and which patient need this food and when not to give it to them. Okay. Let's clear this. Sometimes they put soft diet. All it means is low fiber. So they can interchange it. They will say low fiber diet, but it's or soft diet. It means low fiber diet. And patient have chewing difficulty. Yeah, examples, anything that's low in fiber, like low in fiber, um, and it's smooth and creamy and lightly seasoned. So it's lightly seasoned and it's smooth and creamy. So it's very, very soft. It has no non-gas forming product. So non-gas, it should not be forming gas. That's why it has low fiber. Example is beans. You should not eat the beans, fruits, uh, vegetables. Okay, this is very, very low in fiber. And it's just used, like I said, temporary for somebody who's having problem, or they just had surgery. You don't want them to start them right away. You can use low fiber diet or soft diet. Okay, there's different though with mechanical soft. When you see mechanical soft, that is different. Mechanical soft diet. It's slightly different from um, soft diet. This one you have just difficulty, plain difficulty of chewing, and then they have a head and neck surgery, like throat surgery, head, neck surgery. Yeah, these are specifically designed for this patient. Okay, or somebody who have stroke. The best food is mechanical soft, and then the type of food is any food with minimal, you got to know the criteria, minimal chewing as much as possible, um, like fine diced meat, okay, um, or canned fruits. You see, it's very, you don't need to even chew it, very, on it. Or the vegetables need to be cooked um, thoroughly. Okay, they can cheese and some rice. Some rice you don't need to, and the light bread. Okay, something that is minimally require minimum chewing, just minimum chewing, not chewing too much. Is what they need. Okay, you cannot avoid dried fruit. It can be part of it. Okay, raw fruits, no, because you got to chew, or vegetables. Yeah, they can do that. Or nuts and fruits. Yeah, you got to avoid all those. Okay, then there's sometimes they give you low protein diet, and which patient you need to give it to. Low protein, that means the patient cannot metabolize protein. Example is hepatic encephalopathy. So patient hepatic um, encephalopathy, yeah, you should not give it to them, okay? So you're going to limit egg, milk, uh, milk product, meat. So anything that has low meat and protein in it is what they need. Okay. The opposite is somebody who need a high protein diet, especially you have a burn wound to their body. Yeah. If you're pregnant, yes, you need high protein diet. Um, and those are one, you got to choose food that's high protein diet, like meat, meat product, dairy product. Okay. Um, fish and fowl, anything that has high protein is what they can eat. So you can provide as much as you can for that patient. Okay. Sometimes they give you this PKU. You should avoid certain fruits in them. So avoid high protein diet and that contain the patient with the PKU. All you need to give them is avoid diet that has high protein, especially meat. Okay, so uh, avoid like meat product and dairy product, anything that has high protein, if eggs, yeah, you should avoid it as much as possible and provide them with low PKU diet, which will be like fats, fruits, jam, etc. Low protein as much as possible, and that should be what they need, and that will help with that. Kidney problem, there's a kidney diet. Okay, these people too, they look like too much protein is a problem for them. So you have to give them unsalted vegetables because of their hypertension. They may have hypertension, and some rice is good. Canned fruit is good. You should avoid too much protein in this patient as much as possible. They cannot have beans is not good. Cereal is not good, and citric fruits is not good for them. But that's kidney problem, and you should avoid too much protein in this patient. Okay. Okay. And I think lastly is the vegan. This is briefly. Okay, so there's different kind of vegans. Okay, vegans are people who obtain their protein from vegetarian, their protein from plant-based. Okay, plant-based protein. So animal is out. So everything that's anything to do with animal, yeah, we are not getting it. So what they usually, the source of their protein is mostly plant-based. So that's what they do. They exclude they usually eat like fruit, vegetables, nuts, beans, seeds, as they exclude any animal products. They can't get any animal product or protein. So they have deficiency in B12, which we talk about. They may have pernicious anemia. So there's some vegans say, well, I need some milk. So what they do is they call themselves, okay, lacto vegan. So they can eat vegan food together with milk product. And then there are some that call themselves over vegetarian. That means they can eat um, all the vegan food along with eggs. They can eat eggs in addition. So when you combine them, lacto, ovo, vegetarian, that means they can eat milk products, they can eat egg, and all vegan food. And that's how you can classify all the three. And so just know where they lead you to and which way they can tell you. Vegan, only plant-based. If they have ovo, they can eat egg. If they have lacto, they can eat milk. If you combine ovo, lacto, vegetarian, that means they can eat milk, egg, and vegetarian. And this is briefly a summary of nutrition that you need to know for your NCLEX. Know about the type of individual macromolecule, the fat soluble, the vitamin, water soluble, how much kilocalorie, the deficiency of each of them, what condition you need certain food, and you'll be fine. Take care of yourself and subscribe and enjoy it. Have a good day.